find such a love at our age. Whoever thought we could dance on.
Welcome to Couples Therapy in 7 Words. I'm your co-host, Judy Alexander, and I'm here with my husband, Dr. Bruce Chalmer.
Hello, Judy. Hello, viewers and listeners. And what's the topic for today?
How important is sexual health in couples therapy? An interview with Kelly Ghweinem.
And we just finished our interview with Kelly. As we are wont to do when we do these introductions, we've usually just finished the interview.
Correct.
And yet another really interesting and engaging interview. And hope you'll learn a lot. Kelly works with a group that offers training to therapists about how to incorporate knowledge of sexual health and helping folks with sexual issues into their couples therapy practice. So do check that out. Before we do that, let's put in a plug for some of our books.
Okay. So, speaking of sexual stuff,
Yeah.
why don't we start this week with The Blue Tent, Erotic Tales from the Bible by Laria Zilber.
Gee, Laria Zilber, what an intriguing name.
Yeah, isn't it?
Who might that be?
Oh, stop.
Well, some folks watching this perhaps aren't familiar with our podcast.
Yes, that's true.
And
This
so
might be your virgin podcast
I will
of ours.
I will confess right here
Yeah.
that I have this massive crush on Laria.
Oh, well, she's crush-worthy.
Yes.
Yes, she is my alter ego. So.
Yes, indeed. So it's okay.
So if you want to indulge in some sexual fantasies, this is the book for you.
Absolutely.
And with the holidays coming up, because it is now November, makes a great gift or stocking stuffer.
It absolutely does. And it is erotic tales from the Bible, which is really kind of an interesting niche.
Well, right.
Not many books, if any, in that niche.
I haven't come across books that have all that
Yeah,
in it.
yeah.
So.
And it is, I must say, beautifully written. So do get a hold of that. You can get a hold of that, especially if you go to Amazon. Just make sure to search for The Blue Tent, Erotic Tales from the Bible. Otherwise, they will give you really nice pictures of blue tents, which is not what we're talking about. And how about this book?
Betrayal and Forgiveness actually came up in our interview, so why don't we show that as the next book? How to Navigate the Turmoil and Learn to Trust Again.
Yeah, and that book, Betrayal and Forgiveness, I just came out with that a few months ago, and it's actually selling rather well, I will say. And if you've gone through a betrayal, and most people, if you're old enough, you probably have, of one kind or another. If you have recently gone through a betrayal and you're still reeling from it, one of the things this book can do for you, it's not going to solve all your problems, I will say that up front, but it can make you feel better. It can help you feel better. It can help you have some hope, some direction.
And clarity.
Some clarity, exactly. Some sense that, okay, it's possible to work through this. Trivializing nothing about how painful it is. It's very painful, but it is possible. And if you are the one who did the betraying and you're working on a relationship or you just want to learn from that experience, there's a whole chapter in there, and the whole book would be of use to you, but especially that one chapter.
Absolutely.
So you can get that anywhere books are sold. It's available, as is The Blue Tent, by the way, available in 3 different formats. It's available as a paperback that you were holding up.
Right.
It's available as an audiobook, where the books that I wrote, I did the narration. Judy over here did the narration. Larry and Judy are just like this. And they're really close. And so Judy did a beautiful narration.
Joined at the hip.
Yes. And it's also available for e-readers like Kindle.
Right.
And here comes another book.
Here comes another one. It's not about communication. Why everything you know about couples therapy is wrong.
Yes, that's a book I came out with a couple of years ago. And that one, if you have any interest in the process of couples therapy and how you might benefit from it, or if you are a couples therapist yourself and you want to have some of your favorite ideas perhaps challenged a bit, which is always a good thing to happen. You learn from that. I invite you to get a hold of that book. And then there's the book, as you would like to say.
The book that started it all, Reigniting the Spark, Why Stable Relationships Lose Intimacy and How to Get It Back.
And that's the book, as you said, that started this podcast. Of course, those of you who've come here know the name of this podcast is Couples Therapy in 7 Words. And what are the 7 words?
Be kind, don't panic, and have faith.
And for folks who wonder, gee, why was there a slight pause there? People who are watching the video as opposed to merely hearing it know why. What were you doing there, Judy?
I was holding up our beautiful mugs as part of our merch that we do offer on our website, ctn7.com, that has the logo on the front or on the back. It's two-sided.
On one side.
One side, and be kind, don't panic, and have faith on the other side.
Yes, and that 7 words, be kind, don't panic, and have faith, is the way that book, Reigniting the Spark, is organized. It's
Right.
organized around those 3 essential concepts: be kind, don't panic, and have faith. So do get a hold of that as well.
So without further ado, why don't we get on to our interview with Kelly?
And we'll see you on the other side.
Our guest today is Kelly Ghweinem. Kelly is an ASECT certified and senior associate therapist at Center for Love and Sex. She specializes in queer affirming therapy and helps individuals and couples with challenges like sex after substance use disorder recovery, trauma healing, discrepant desires, anorgasmia, I hope I got that right, erectile challenges, and non-traditional relationship concerns. She writes an intimacy and relationship column for Out SFL, the leading LGBTQ plus newspaper in South Florida, and is a contributor to Skirt magazine. Kelly, welcome to Couples Therapy in 7 Words.
Thank you for having me. It's an honor to be here today.
Oh, it's great to have you.
Pleasure.
So we always like to start off by asking our guests, how did you get into the work that you do? Tell us something about your own journey into this.
Yeah, so I have been in the human services field since I've been in the working field since like 18. So to give you a little bit of family history, my mom and my grandma both worked at group homes for people with developmental disabilities. And so it was something that working with people, helping them was something that I was exposed to at a very young age for a career. And then I worked at a group home myself for many years. And then I ventured off a little bit into the corporate world, and I was like, this is not for me. So I went back to school to pursue my degree in social work, knowing that I wanted to be in private practice as a therapist. And in my social work school, I took a class on couples therapy and really fell in love with it. I just loved the approaches. I loved that you could help couples really bring back that like love and passion and work through conflicts in their life. And so when I graduated, I went to the University of Buffalo. I moved to
my hometown.
Really?
Yeah,
Oh,
my parents both graduated from the university. At that time, it was called University of Buffalo. But sorry, don't mean to derail you. But
yeah.
oh boy, you're talking in fact, I might start talking funny, like because my Buffalo accent largely went away when I went away to college, but it can come back very easily when you say Buffalo. Anyway, please continue.
Yeah. So after I graduated from there, I moved to New York City, where I started working in substance use recovery. And so I had to, do my supervised hours. I did that in recovery. And while I was working, I started a group on relationships and sexuality in early recovery, because a lot of times people that I was working with, they've only had sex or relationships when they've been under the influence of something. Even if they started at a very young age, maybe they started having sex at a young age, but they also started using substances and they don't know how to have those relationships. And so I started to look more into, okay, how could I better help individuals? And I came across ASECT certification for certified sex therapy and decided, okay, once I graduate, I'm going to, or not graduate, once I get my clinical license, I'm going to pursue my sex therapy certification. And I was also really heavily influenced by like Dr. Ruth and Dr. Johnson, right? Like those were 2 women that really spoke directly about sex and made it very unstigmatized.
Like
And
I'll
so,
mention, both
yeah.
of them recently passed away.
Yeah, very sad.
Dr. Ruth both died in the last several months. So
Yeah, very tragic for our field because they were so influential.
Mm-hmm.
Mhm.
And so then after that, I pursued my ASECT certification. I started working at the Center for Love and Sex with the co-founder of Erotic Intimacy Academy, Sari Cooper. She was my supervisor, and I finished my supervised hours under sex therapy certification. And then I continued to work with her, and I also opened my own private practice, Velvet Psychotherapy Collective, which is focused primarily on the LGBTQ community. So that's a long, short version of how I got into it.
So for those of us, Bruce is a therapist, I'm the lay person. Can you tell us what ASECT stands for?
Yes, I'm gonna have to look it up because
American
I
Association
don't know
of
it off the top of my head.
Educators,
So
Counselors, and Therapists. Have I got that right?
pardon?
Something like American Association of Sex Educators, Counselors, and Therapists.
Yes, that's exactly it. Yep.
I knew it was something like that. Anyway,
Yeah.
it's a group, as you point out, right? It's a group that certifies people who do sex therapy,
Yes.
training and certification.
Yeah, I think it is one of the only ones that is accredited in the US for sex therapy certification. So it's kind of like the gold standard if you want to be a certified sex therapist. And there's only a couple states in the US that requires that you're a certified sex therapist to practice sex therapy. Other states, you don't need to be certified. You can just practice sex therapy, hopefully having some training, but as long as you are a certified therapist or a professional therapist, you can be a sex therapist.
I forgot who it was. It might have been Joe Court, or I don't know. We've interviewed numbers. I don't know if you know that name, Joe Court. He's
oh yeah, Joe Court.
Yeah, Joe Court. Yes, well known, certainly among sex therapists. We interviewed him some months ago or last year, whenever it was, and he may have been him that pointed this out, or someone else pointed out. Every couples therapist is a sex therapist, whether you know it or not. And I don't mean to say we're all trained that way, but I am curious. I mean, I do couples therapy. I am not certified as a sex therapist. I realized very early on just how I had to be comfortable talking about sex with my couples. And I will tell you my little anecdote, which you've heard probably a few times, but you haven't heard this. It was a couple years ago now, I think. I was at a training. We all have to get continuing education, as you know. And so I was at one of those trainings, and it was on Zoom. There was probably 150, 200 therapists, and it was about couples therapy. And the trainer did a little survey and said, okay, how many of you ask about a couple's sex life in the first or second session, early on? And I'm thinking, well, duh, obviously we all have to, and it was less than, I think it was about a third. It was a considerable under half. And the other people who didn't were saying, oh no, I wait for them to bring it up. And it just was astonishing to me. Could that, all of that being a wind up by inviting you to address, like, why is it important to include considerations of sexual health, sexual functioning in couples therapy?
Yeah, so I think that there's many reasons why, but a big one is that sexual health is mental health, right? Like we want to be as intentional about our sexual health as we are about our mental health and our physical health, because studies have shown that couples who have more sex, not more, but better sex, they have good sexual open communication, they have good sexual relationships, have more satisfaction within the relationship. So they're having this quality of relationships that just feels better. Also, people that have sexual dysfunction also sometimes, a lot of times, they struggle with things like anxiety and depression. They feel isolated. They have low self-esteem or low self-worth, right? So your sexual health is directly connected to your mental health and overall well-being, emotional well-being.
And, folks who are long-term viewers and listeners of us know, before I was a psychologist, I was a statistician way back in the day. So this is coming out of my statistical brain. And it's always fascinating to me because, I work with couples. And all the stuff you said, of course, the direction of causality is, causation is not the same as correlation. And the direction of causality can kind of work in both ways. That people who are having sexual issues might then discover that it makes them anxious and it causes other relationship problems. Of course, people who are having relationship problems might discover that it kind of wreaks havoc on their sex life. It sort of becomes cyclical. And I'm always curious, when we've talked with sex therapists,
Mhm.
people who are specifically trained in sex therapy, I'm thinking especially of Batsheva Marcus, who
Mhm.
we interviewed a long time ago. Um, it's fascinating that what she wrote a book, Batsheva wrote a book where I enjoyed pointing this out to her. She had a whole chapter in her book basically warning people against people like me. And I really appreciated it. I said, yeah, she's right. Because people like me who come from the relationship side just generally assume that if there's problems in a couple's sex life, it must be because of the relationship. If you would
Yeah.
just, and what Batsheva points out, and she works with women especially, and she points out, no, sometimes there's physical stuff. Sometimes there's
Yeah.
hormonal stuff. Sometimes there's stuff that if you address the physical, the relationship stuff then becomes possible to work on. But don't ignore the medical. Don't
Yeah.
ignore that stuff. Like,
Yeah.
could you comment on any of that?
Yeah, absolutely. So going back to, thinking about how sexual issues could impact mental health issues, right? If we inverse that, mental health issues impacting sexual health issues, people that are like anxious or depressed, maybe they're withdrawing from the relationship, they don't want to engage in sexual relationships with their partner, or if they're not partnered with anybody, right? And with that causes relational problems. But speaking to exactly what you're talking about, like medical issues, if you don't know how to ask or what to ask, let's say you don't have the knowledge about how pain during sex, penetrative pain, if a woman or someone with a vagina has penetrative pain, they're also might feel anxious about sex, not want to engage in it, or if they do engage in it, it's not pleasurable for them, and then that also causes relational issues. Or let's say someone who has erectile dysfunction because they are using a lot of cannabis or they're smoking a lot of nicotine, then they are experiencing erectile dysfunction, but they come in and they say something like, well, I think it's because I'm so anxious about it. And then they're able to control their anxiety, but they're still experiencing erectile dysfunction, and having the ability to ask those questions and know to ask, okay, well, what is your cannabis use like? What is your alcohol use like? What is it like when you're in, bed with someone and you're thinking about having penetrative sex, right? Like those are the questions that we want to ask, because and as a therapist or as a coach, you want to get comfortable knowing what to ask and how to ask so that you're getting to the root cause. And what I thought too, when I was just a general therapist, is like it's very relational, right? It should be if we fix the relationship, the sex will come along. But that's just not how things work. And so we want to have a comprehensive biopsychosocial assessment in the beginning of our work together so that we can get to, okay, what is really going on here and how can we help?
Yeah. Yeah, that is so interesting. The whole erectile thing is fascinating
Mhm.
because it is also, I mean, it's kind of a given that anxiety tends to be part of that. That
Mhm.
starts to become cyclical. If the person with the penis is finding, uh-oh, now I'm worried, it's not going to work, which is about the least sexy thought one can have.
Right.
And if their partner is saying, oh no, you're not finding me attractive, and it's about that, and boy, that sets off a death spiral. And
Yeah.
yet, if nobody asks, by the way, you on blood pressure medication? You on antidepressants? What's going on? If nobody asks that question. It's like, actually, I'm reminded of an anecdote I don't think I've told here. I don't think I've told this one before, which is kind of astonishing because I tell them all. But anyway, here it is. This is somebody early on, and this is close to 30 years ago now, early in my own private practice. And it was an individual I was working with, and it was a guy who came in and he said he needed help with not being able to maintain an erection. And
Mhm.
yeah, I didn't have specific expertise about it, but I was certainly happy to talk to him about it. And we're talking about what the situation was, and he was just this is before Viagra existed, so that was not an option. He couldn't
Wow, the
try that.
dark
The
ages.
dark ages, yes, way back when. That's how far back I go. And that what he was about to be fitted for one of those inflation things that they,
Mhm.
implant type things. And I asked him a little more detail, and it turned out it wasn't that he couldn't maintain an erection, it's that he would come instantly.
Oh,
It
yeah.
was premature ejaculation. He would come really quickly, and then, of course, he couldn't maintain an erection right away because there is that refractory period. But his doctor never asked him that. His doctor
Yeah.
never said, "Well, tell me the details here." So he's saying, "I can't maintain an erection." It's not that he couldn't maintain an erection; he had an erection fine. It's just that he lost it too quickly,
Yeah.
by having an orgasm. So he had to learn the skill of delaying his orgasm. And I don't remember the end of that story. I don't remember.
Yeah.
Did they all live happily ever after? I really don't remember, but I remember being impressed with that. Like, your doctor isn't even asking you. That reminds me of something you were talking about, or you sort of alluded to, that I remember Batsheva talking about too. It's not merely that a lot of doctors don't ask, it's even OBGYNs don't ask often,
Mhm.
which is really fascinating.
Yeah, so I'm actually glad that you brought up that anecdote, because something that we talk about, me and Sari talk about at the Erotic Intimacy Academy is, and that's where we teach therapists how to integrate sexual therapy interventions into general therapy, right? Or relationship therapy. So something we talk about is how to help your clients advocate for themselves at the doctor, because a lot of doctors, whether it be a PCP, a gynecologist, or a urologist, they're not really as informed about sexual health as maybe you would expect them to be. So something like sexual pain, maybe they're a person with a vagina comes in and says something like, I'm having a lot of discomfort, or it's uncomfortable. And then they could be dismissed by saying, oh, that's, just use a little bit more lube, that's normal. But if they were to ask more questions of like, where do you feel the discomfort? Could you describe what that sensation feels like? Maybe they say something like it's inside and it's burning, and it's stinging, right? And so they would be able to then, if having those questions asked, they would be able to then make a more they'd be able to make a better diagnosis of what's going on rather than just dismissing it. But a lot of doctors don't really know how to ask that. So if, as a therapist, okay, you're having pain with intercourse, make sure you ask your doctor these questions. This is why you want to ask these questions. Are they doing this, maybe they're doing the Q-tip test, where they place a Q-tip on your vulva to see where if it's painful, how painful it is. Did they do that, right? Like, you're helping your clients advocate for that, because a lot of doctors don't know, or helping them find a doctor that is knowledgeable about sexual health practices and does have that additional training.
Yeah. And that's, I think, a nice segue into asking you specifically about the training program you mentioned. And I noticed you have the acronym SEE-IT, which I think is kind of cool. Could you tell us about the training that your group offers?
Yeah, thank you. So the See It training, which we also really liked that, because it was like the things that you miss, right? You're going to be able to see it when you're done with this training. So it is a comprehensive training. It qualifies for ASECT CEUs, and also if you're in New York State social work continuing education credits. And it is for therapists who are general therapists. Maybe they've been in the field they're new to the field, they just graduated, or they've been in the field for 15 years. They're a couples therapist or an individual therapist, and they want to enhance their skills by learning more about human sexuality. And in our program, we have 10 webinars that have already been pre-recorded. And then we have, with that didactic information, we also have information to read, so that you will get that before we meet for case consultation. Each webinar is a different topic, where we discuss, okay, these are the things that you could see in your practice. These are the theories that go with it. These are the interventions, and this is how you would use the interventions. And so the way that our program is set up is we really focus on how are you going to use these interventions, because we get a lot of information of, okay, this is what the theory is, you have this knowledge, but people tend not to really know how to integrate that into their practice. And then they feel like, well, okay, so I know that SSRIs can cause erectile dysfunction, but how do I ask about that? What do I ask about that? And so our program, that's where we teach, this is what you ask, this is how you ask, right? So we have topics like erectile dysfunction, or it's called unpredictable erections and painful penetration, where we talk about that. Or we talk about what else? So we talk about discrepant desire, after infidelity, LGBTQ issues. What else do we talk about? Sexual health practices, right? So all of those, we go into a lot of in-depth evidence-based, it's all research-backed information, and the students are able to access that before the case consultation. And then once a month, we have a case consultation where someone or a couple students will bring one case and we discuss it as a group. And that case is directly tied to whatever the topic is that month. So we'll just stay on, painful penetration because we've been talking about that. So let's say that it's pelvic pain. The student would bring the case consultation, we would all talk about it as a group, and then me and Sari would give specific feedback on, okay, this is what we think you should do, how you should do it, right? Like true like clinical case consultation that we also don't get a lot of. And it goes from January until November.
So that's like monthly meetings for like 11 months.
Yes.
Yeah. Wow. I'm reminded when you're talking about that problem, those of us in the field will go to get some training and then figure out, how do I integrate this? And I remember something I learned, I think this was Michael White. I don't know if you're familiar with narrative therapy.
Yes.
It goes way back. Anyway, he died 20 some years ago. But I did a lot of training with Michael White, a guy from Australia, who's kind of the guru of narrative therapy, though he absolutely bristled at the idea of being called the guru of anything. That was kind of part of the deal. Well, in any case, he would always point out, one thing you can tell folks you work with is, I just went to this training and learned some really cool stuff. So let me share some of that with you. That's why I'm asking you this. I just learned about this stuff. And people are often, it was fascinating because so often people would assume we have to present ourselves to our clients as if we are these experts from the mountaintop and don't get to say things like, hey, I just learned something interesting. I think maybe it'll be helpful, and he would encourage people to say, no, you get to say that you can be transparent about that.
Yeah. I think, I noticed in my training, especially with CEUs, a lot of them would often be like very foundational information, and then it wouldn't be more in depth. And I was always left kind of disappointed with what I was getting. And so that was a focus when Sari and I were developing this program. We really want it to be in depth and kind of dense, right? Like we want people to walk away with, okay, I actually got something out of this. I know this information and it was worth my time and it was worth my money, right? That's important for us to, when we were developing the CIT certification.
Now, you say that you specialize in queer affirming therapy. Can you talk a little bit about what that is?
Yeah, so queer affirming therapy is when someone who is a part of the LGBTQ community, or maybe they don't identify as part of it yet, they come into therapy. It's allowing them to feel safe and comfortable in the space where they know that their clinician, who would, be me, is a queer person, so they understand what some of the struggles that they have gone through or how the stressors impact them. So that looks like things like, you can't really see it behind me, but I have this like rainbow thing here. So you can see it in the background, or up in the corner there, it's a map of New York City and it's a rainbow. So it gives like indication of, okay, these are some indicators that this person is a safe person to talk to, but also putting it out there, like in my biographies and on my website and things like that. when people are looking for a therapist, they know, okay, I'm not going to have to explain to them what this means. Like they're going to know. Not saying that as a queer person, I know everything that they're going to say, right? Like things are always changing but they know that they don't have to give that extra education and that there is some level of understanding and that there is safety there.
Yeah, I would imagine it's not merely that you're apt to know stuff that a non-queer person wouldn't know, but you're not going to freak out about it either, which I think is really the key, that somebody can feel safe being who they are and know that they're not going to be sort of subtly, the therapist is going to subtly give them the message that you're not supposed to be that way, or, why can't you be some other way? They'll be able to be who they are, which is kind of the first in any sort of therapy, of course. That's somebody better feel that way or they're not going to get much out of it.
Yeah, exactly. And that comes up a lot too in not just queer affirming therapy, but kink affirming therapy or non-traditional relationships, because for a long time, kink was, or BDSM, that was seen as something that maybe was a mental disorder. You shouldn't be doing those things. It was so heavily stigmatized, and it still is kind of stigmatized. So having someone that is kink affirming, not just kink aware, is also important. So people know, okay, I can come and actually talk to this person about this, and they're not going to, like you said, freak out. They're not going to judge me, and they're not going to give those subtle microaggressions that maybe make me feel uncomfortable in therapy.
Yeah, it's interesting with respect to things like, kink, because even when it's not explicitly pathologized, even when it's not saying, oh, that's a disorder, there will be a subtle thing that says, well, you're working out childhood problems, or it'll be subtly pathologized. It's like, oh yeah, if you were actually mentally healthy, you wouldn't need that, but I can see why you need it, and so I can affirm it. Well, that's not really affirming anything.
Yeah.
And yeah, that's Joe Court we mentioned earlier. He talked, he actually wrote a booklet about that we interviewed him about on erotic orientation, which was fascinating. But different from sexual orientation. Erotic orientation is really about, okay, independently of what kind of body type turns you on, like what turns you on in general. And that's where things like kink come out. It's like, wow. And we also talk with Artemisia Devine, who talks a lot about fantasy, fantasy in a very non-pathologizing way. It's really interesting because a lot of folks do that sort of subtle, pathologizing of people's fantasies.
She has a background as a sex worker.
Yeah, she herself was a former sex worker, and it developed a lot of her ideas doing that.
Yeah. Yeah. And, when I see clients as a sex therapist, a lot of them come in with the internalized shame about it. And, those ideas come out of like, okay, I have this kink. Why do I have this kink? Why do I have this fantasy? Like, is there something wrong with me? Is it related to this thing? And really wanting to find if they have, if they're feeling shame about it, really wanting to find out that reason why and pathologizing it themselves. And I think a lot of our work, not I think, a lot of our work is really separating the kink from that shame and coming to a place of acceptance of, okay, this is my, erotic orientation. This is what I like, and that's okay. Like this is bringing me pleasure, and I am accepting of that. And really, I want to engage in that.
Yeah.
I would imagine that there's a lot of guilt and trauma surrounding people that come to you. Yes.
Yes, absolutely. So working with people who have experienced trauma and helping them have pleasurable sex after trauma is something that I work with a lot with clients, and that can be difficult for them because sometimes people experience trauma when they're sexual trauma before they're pre-verbal or they don't remember it, but it's stored in their body and they have reactions to sexual situations and they don't understand them because they don't remember the trauma. But working together, it's not that important to remember the details of the trauma as long as we're working somatically with okay, how do we heal this? How do we focus on the central nervous system so that you're not having this reaction in the moment? And then also working with people who remember their trauma and it is directly impacting their sexual relationships. How do we heal from that and have pleasurable sex after trauma?
I used to do a lot of that work with folks as I was trained in EMDR.
Mhm.
I used to do a fair amount of working with people who dealing with one kind of trauma or another, often sexual trauma. I'm curious because you mentioned one of the topics that you do. By the way, what does See It stand for? I
Yep,
know you have it.
it's
Yeah, go ahead.
yep. So it stands for um, sexually educated, erotically informed therapist.
Ooh, that's so cool. Yes. So I was curious. One of the topics you mentioned, I just recently wrote a book or released a book about betrayal and forgiveness. And so I was especially interested to hear you say one of the topics you deal with is a couple's sex life after there's been infidelity. And I'm
Mhm.
curious, how do you work with folks around that? What comes up?
Yeah. So it depends on what phase of their recovery that they're in.
Mm.
And so sometimes people come to see us directly after the betrayal happens, and maybe they're in a place there of not knowing what they want to do, if they want to stay or if they want to go. And I've found that, and this is purely anecdotal, people in that phase tend to be having more sex than they
Yes.
were prior to finding out, right?
Isn't
They're
that
trying to,
fascinating? Yeah, I
yeah,
find that
they're
too. Yeah.
they're trying to get back together, feel safer in the relationship. So there we're working through what are the emotions that are happening with the infidelity. How does the hurt partner feel? How are they taking it? How does the partner that did the betrayal, how are they feeling? But also what led to this, right? So if a lot of times people just think, well, they're unhappy in the relationship or they're not attracted to the person anymore. But pulling on Esther Perel's work is what was happening in the relationship before this happened that kind of led to that. There's a lot of things that could contribute to someone stepping outside of their monogamy agreement. And so in our training, we talk about what could those reasons be? How can you talk to the couple about it? How do you not kind of put in, like, not rush them, but how do you not make the expectation that they have to make a decision on what they want to do and that they can kind of work through this space of and like I don't know what to do here, right? Like I don't know if I want to stay, I don't know if I want to leave, and feeling comfortable being in that like unknown space.
Yeah, that ability to tolerate that anxiety for a while. That's one
Mm-hmm.
of my big things I always talk about, that intimacy, the chief skill of intimacy is tolerating anxiety rather than avoiding it. And that's a great example of it. It's also interesting the issues around what constitutes infidelity and
Mm-hmm.
what is the meaning of it in the relationship is fascinating. And one of the things we've interviewed several people, the first of which was actually the rabbi of our synagogue, who is a gay man.
Mm-hmm.
We interviewed him early on in this podcast just because it was during the pandemic and he's a great guy. And so we wanted to interview him. And we were talking about, among other things, he was talking because he's being a rabbi, he works with couples quite a bit, mostly straight couples, that he's working with. And he finds that straight couples can learn a lot from gay men around
Mm-hmm.
that because gay men are more, it's not that gay men don't have issues of infidelity, of course they do, but they're more apt to be able to talk about it right from the get-go than straight couples are.
Yeah.
So, I would imagine, in queer affirming therapy, and those of us who work mostly with straight couples
Mm-hmm.
can learn a lot from the ability of people who aren't in sort of standard, cisgendered heterosexual relationships to be able to talk about stuff in ways that most straight couples don't know how to do. Can you comment on that?
Yeah, so I think, in queer culture, and this isn't everybody, right? But a thing in queer culture is non-monogamous relationships. And so part of non-monogamy is having that open, honest dialogue. What are the expectations? What do we have a monogamy agreement, or is it okay to, don't ask, don't tell, or we talk about it, or maybe we have group sex together, right? And so I it's that is kind of, it can be a norm within the queer culture, especially among gay men. It's, non-monogamy is very prevalent. And so I think that cisgender heterosexual couples that are monogamous can learn a lot from people that engage in non-monogamy about how to have open, transparent communication that talks about boundaries, that talks about, okay, this is how I feel about this, and this is why I feel this way. And being able to, again, sit in that discomfort of the conversation, knowing that we're working together to find something that makes us both happy and satisfied in the relationship.
Yeah. Yeah, that's, in the era of the internet has created questions of what constitutes monogamy that never existed before.
Yeah.
It used to be, okay, is somebody looking at pornography cheating?
Mhm.
And there are couples who feel it is and couples who feel it isn't, and of course, all of that. Nowadays, it ain't just looking at a magazine, it's all right, what if you're interacting with another human being on the other end of a connection in real time, as opposed to what if you're looking at somebody, but you're not interacting in real time. And there are plenty of couples who would consider one of those cheating and the other not. And there's couples who would consider both of those things cheating. It's really fascinating.
Yeah.
And what I always like to point out to folks, whatever you think you feel about that isn't set in stone. It's sometimes that changes over time, and that's, you have to be able to talk about it.
Yeah.
And also exploring where those beliefs come from, right? Do you believe in monogamy because that truly is your relationship orientation? Or do you believe in it because we're raised in a heteronormative society where that's the expectation, and you feel like something would happen, or you would have a terrible relationship, or you would be a terrible person if you were in a non-monogamous relationship?
Yeah. Wow.
It is
It's a whole new
complex.
world.
Yeah, it is definitely complex. What else should we be asking you about?
I'm not sure. I don't.
Or what else would you like to
What
talk
else?
about?
Yes, is there things that we haven't brought up that you'd like to talk about?
I think that's everything.
Well, good.
Okay.
That's great. How can people get in touch with you? And I'm thinking especially of, therapists who are interested in the See It program. And also, I don't know if you do telehealth with clients outside of your area or what, let folks know how to get in touch with you.
Yeah, so I do telehealth in New York, New Jersey, Florida, and South Carolina. And they can reach me at kelly@centerforloveandsex.com or info@velvetcollective.org, either one of those. But for the Erotic Intimacy Academy, which is the digital platform where we host the See It certification, if a therapist is interested, they can go on www.eroticacademy.net. We have an application, and we also have more information on the See It certification there. So for the application, they would, sign into the platform, fill it out, and then send us a resume and a cover letter with their information. And then we would get back to them if they're accepted into the program, which is going to start early July 2020, or not July, January 2025. I don't know where I got July from.
Soon, get those applications in.
Yeah, for those who are, we never know when people are actually watching this. We're recording this in November of 2024. So thank you so much for doing this.
Yeah, one more thing. Sorry, we are going to be having rolling admissions for the program because it's going to be ongoing. So let's say it's December and you're not ready to start in January, you can still apply and start in February or March, and then you would just meet with the next cohort for the case consultations. But if they have any questions, they can email us at eroticacademy24@gmail.com.
Now, do they already need to be therapists before going into your program?
So they can be a therapist that has just graduated or in school, or a fully licensed therapist, or if they're a coach. But for a coach, you do have to have 3 to 5 years experience working with couples and some sort of coaching certification.
Yeah. So you're needing people who have training in working with folks.
Right.
You're not talking about people who have, might be interesting to be a therapist. Maybe I should check out this. You need people more advanced than that.
Yeah, because in our case consultations, we're talking about cases, and you're really going to have some fundamental just knowledge about therapy and other interventions to be able to understand, okay, how is this different, and how are you integrating this aspect of human sexuality into your general practice.
Right.
Well, again, thank you.
Thank you. Thanks for having me.
Welcome back. We hope you enjoyed that interview with Kelly as much as we enjoyed having her on our show.
Absolutely. And so we're just going to briefly recap a couple of things that people ought to do when they're, especially the folks who made it through to here. In fact, I want to invite you, if you are watching this part of the interview, which means you went through the entire podcast, unless you fast forwarded to this, whatever,
Maybe.
drop us a line. Just let us
Yeah.
know that you did.
Okay.
Give
Or
us some-
listening. You don't even have to.
or listening, exactly. Yeah, just give us some feedback. Let us know that you made it to this. And of course, what do we want to tell those loyal folks to do?
We want to tell you to follow us, like us, and share us on social media. Let your friends know. And, just tell everybody about it.
And also, if you are one of those folks that has seen through to the end, you're a really good person to remind if you have topics of interest. Let us know. And as you mentioned, our website, CTN7, that's the number 7, CTN7.com. That is our website for couples therapy in 7 words, and you can contact us through that. And of course, I just got to mention, buy our books too. If you like our interviews and you like this podcast, you will like our books.
Yeah. Yes, and if you would like to be on our program, or if you would like to send in a question that you'd like us to talk about on the air, or a topic that you'd like us to discuss, you can let us know that on our website as well.
And so until next time,
Remember, be kind
don't panic.
and have faith.